Dr. Green, welcome to the Tick Bootcamp podcast.
Well, thank you. I am glad to be here.
And we're really glad to have you because you're one of the pioneers. You're one of the long-term members of ILADS. So we're here at the ILADS conference, and we were told we needed to interview you, and I'm glad we finally were able to connect. So let's talk about ILADS first. How long have you been a member of ILADS, and what type of work have you done with ILADS?
So it's in the dark ages, but I think I became a member around 2004, 2002, 2004. And
so almost as long as there's been an ILADS, you've been a member.
Almost as long, yeah. And I have to say that ILADS provided me the information I needed to really dive into Lyme. My first case of Lyme was in 1989.
Wow.
And I figured out how to treat it, as most people do, even today, by going to the basic literature, because what the party line wasn't working for patients. Something was wrong. But ILADS, and I want to acknowledge ILADS in its 25th
Please.
year.
Yeah, let's do that.
It's really done a yeoman's job of kind of teaching doctors. And even today, even at this conference, after I don't know how many conferences, I have learned new things. I've learned new things about biofilms. I have learned new things about long COVID and Lyme. And I'm part of an organization that we create CME modules, Invisible International, and I've actually moderated a panel on long COVID and Lyme, but I still learn more here. I would also like to acknowledge 3 doctors who have gone on. One is Nick Harris, who, because of Nick, creating a lab that could find evidence of Lyme when the party line, when the CDC was requiring tests that are very hard to get positive, even if you have active Lyme. And he created that, and because of that, we could have an ILADS. We could diagnose patients, and we could move forward. Also, Charles Ray Jones, who everyone knows was the pediatrician, all of these people were so generous with their time. I sat with Jones many a time and really learned how to approach a child with tick-borne disease. And finally, Dave Martz, who I think we lost last year, who had ALS and was an oncologist in Colorado Springs. And lo and behold, they tested for Lyme, and he was negative because he was a hunter. And he had gone on to close his practice and to move into his wheelchair. And his son sent him a newspaper article. This is really important for the kinds of things you're doing. That said, watch out where you test for Lyme, and mentioned IGeneX. And Dave ended up positive at IGeneX.
Wow.
And basically cured ALS. That's the wrong thing to say. What we view when that happens is, it was a misdiagnosis of ALS.
Right.
But mind you, he was diagnosed by 4 neurologists, and he was head of the medical society in his town. So they were good neurologists. But he went back into practice for a few years and saw. So I want to just acknowledge those people.
Thank you. Yeah, thank you for acknowledging 3 of the pioneers who have gone on to the other side, but they're remembered, and now they're going to be remembered forever because you mentioned them, and this will be up on the internet after you and I are gone. So thank you for sharing that with our listeners. So, Dr. Green, why don't you talk to us a little bit about your experience with treating Lyme disease, and what observations, as one of the pioneers and veterans of this disease, what observations would you make to a new patient, because we have a whole spectrum of patients that listen to this podcast. What observations would you make about how far things have come?
How far things have come?
Yeah.
Not as far as they should have.
Okay.
Right. I would say when I get a new patient, the story is frequently that they have seen 10 to 20 doctors in various specialties. And it's not all tick-borne disease fault. it's also the way medicine has gone. If you're only going to spend 5 minutes with a patient, you're not going to get the information you need. I have had patients tell me that their primary care, if they go in, will say, we can talk about one of your problems today. What is that one problem you want to discuss? Which, to me, as a classically trained doc, is crazy. You can't make a diagnosis that way. You have to have the whole picture. I was taught that if the patient walks in and they have 10 problems, you have to find one diagnosis to explain those 10 problems, because it's unlikely they're going to come in with 10 new diseases, right? But that takes time and it takes smarts. So what I would tell patients is, if you're ill and you've done your best to figure out what to do and how to get better and what's wrong, and you're being told it's all in your head, or maybe, this is my favorite, several of my patients were told that they were sick because they had 3 children. I have 3 children, and I've been fortunately healthy all my life. And I thought, wait a minute, how does 3 children make you sick? So stick to what your body is telling you. Don't let yourself be marginalized. Keep seeking. There's somebody out there who will hear and will follow up.
And I also think that what you're suggesting is that if you're going through the medical system and you're taking various tests and the tests are coming back negative, but you really know that you're sick, part of what you should be doing is, yes, staying true to your onboard diagnostic system and believe that it's giving you the signal that you need, but also make sure that you think about Lyme, right? Because one of the classic things that we also see in Lyme disease is not that not only have they seen many doctors, but all the diagnostic testing is coming back negative, right?
That's
and,
right.
and that's part of the reason why the doctors are saying that it's all in your head. The truth is, we should be thinking Lyme if all of our diagnostic tests are not yielding a result and we still know that we're sick. I want to talk to you about the all in your head piece as well. We've interviewed Dr. Leo Shea on this podcast several times. One of our favorite people, quite frankly, in the world. He's just a wonderful human. One of the things that Dr. Shea taught us when we interviewed him a couple of years ago, and we revisited again this weekend when I interviewed him, was that anytime you have an emotional or a psychological or psychiatric presentation, there is a physiological foundation. So when a doctor is saying to you it's all in your head, which is of course triggering and it's painful and it leads you to believe that you're crazy, really what a doctor is saying to you is not that there's something wrong with you, there's something wrong with the doctor's capacity to determine what's wrong with you because of the way it's presenting. And what we're really hoping here at Tick Boot Camp to do is to change the language that doctors are using when they can't discover the cause of an illness. What doctors should be saying is, you have a psychiatric or psychological presentation, and I don't have the capacity with the limited prism I'm looking through as a Western practitioner and specialist. We need you to go to someone else, and I have a recommendation. So that you're not putting the patient in a position where they're suffering more emotionally and therefore more likely to get even sicker because they'll be stuck or put into the sympathetic expression of their nervous system and shutting down their immune function.
Yes, I agree. I think that's exactly right. And I think there are physicians who do that. I've had patients have the physician look at them and say, I know you're sick. I don't know why. I can't help you. I'm much more like your statement that I feel as a physician, if I can't help a patient, my job is to tell them where to go to get help. That's my expertise. I know my colleagues, I know the field. So I think that Dr. Shea is absolutely correct. That's exactly what we should do in a way of taking care of patients. Lyme, and I'll stick with Lyme, not Bartonella, although Bartonella falls under here too, it's a disease that bug doesn't care where it goes in your
Oh,
body.
for sure.
Most bugs have tissue tropism. You know, you're going to get this bug, it's probably going to give you pneumonia. You're going to get this bug, you're probably going to get meningitis. But Lyme and Bartonella really can go to any tissues they want.
They're agnostic.
So
They'll go
the
anywhere, yeah.
presentation, 50% of kids, Freed did this work in the mid-90s. He's a pediatric GI doc. 50% of kids present with GI symptoms in Lyme. Dr. Ed Breitschwert, who, if you haven't interview him.
Yeah, we have. We love him.
He told me once, he said there's no tissue in the laboratory that Bartonella hasn't invaded. He said it just doesn't matter. It'll, because it makes its own blood vessels. It's a very, very clever little guy.
Bartonella is a scary, scary germ. It is scary.
Yeah. And so I would say the other part to a Lyme patient or tick-borne disease patient is often they're hearing they just have too many symptoms.
Right.
So it must be, quote, in their head. And that's not right.
And migrating symptoms, right?
That is, in fact, and again, Rich Horowitz showed this with his validated questionnaire. There are three things that correlate very highly with it being Lyme disease. Migratory arthralgia, that's migratory joint pain, migratory myalgia, migratory muscle pain, and migratory neuropathy. And for patients, if they get a tick bite and they start getting weird numbness, tingling, weird headaches, they should they should get an antibiotic.
And look, I'd argue anytime you get a tick bite, you need to go to your doctor and you need to have a conversation about treatment options, regardless of whether you're symptomatic or not.
Yes, and keep the tick and send it somewhere. Tick report, send it somewhere.
Yeah.
I also should put a plug in here because this happens. I'm from California, and the second Lyme disease study in the nation occurred in the Ukiah area, Mendocino area of California.
Really?
Yeah, really. And in fact, my first patient was 1989, and I found that study, after talking to the people on the East Coast. But patients in California, and Kaiser is guilty of this too, are constantly told they can't have Lyme. They aren't even asked their travel history, but anyhow, they can't have Lyme because they're in California. That is not true. Northern, southern, especially the Coast Range and the foothills of the Sierra. So I just want to say, if you're out there in California, you can still have this disease.
Well, Lyme has been found in all 50 states.
That's right.
And there may be a greater concentration.
Except maybe Hawaii.
Well, actually, we actually interviewed two doctors from Hawaii here this weekend, and they are treating Lyme patients in Hawaii.
No, they are. But the tick that carries Lyme is not in Hawaii.
Okay.
They have babesiosis for sure, but I have several Hawaiian patients, and as we trace their Lyme, I think they got it coastside. Yeah.
But it's only going to be a matter of time because birds are infected
That's right.
with ticks.
You are right. It's a long way, but they'll get there.
They will get there, and ticks are, they're ancient vectors, right? They've existed longer than we have. Lyme is an ancient bacteria. It's existed
right,
longer
the
than we
Iceman,
have, right?
Yeah.
So certainly in Etsy the Iceman, but even, I think there's fossil proof, actually in the New York Museum of Natural History, that has ticks that are millions of years old.
Yeah.
So we are dealing with ancient vectors and ancient bugs. They've been around much longer than me and you. So talk to us about what. Let's give our listeners, as we wind down this initial conversation, I'm really blessed to have met you, what are some of the things that are encouraging you on the horizon? Give me one or two things that you see happening that are encouraging to you that our patient community of listeners should be encouraged by.
I think there are many things. I think starting in about 2014, when Dr. Zhang at Johns Hopkins took Ava Shapi, I want to want to acknowledge Dr. Shafi.
Yeah, we love Dr. Shafi.
Ability
Yeah.
to culture. Stabilized it and started testing what will kill Lyme. It really, and then he did Bartonella too, it really broke the field open. Monica Embers at Tulane
Dr.
now
Embers is
has
awesome.
animal models for Lyme.
And primate animal models.
And
yeah.
primate, and has shown all sorts of things. She's shown that if you treat Lyme with doxycycline and they get well and it comes back, hey, guess what? The doxycycline still works. You don't build resistance. You build some tolerance, but not resistance. So I'm very encouraged that we actually can target the organisms. We know they're persisters. We can go after those persisters. Some of the cutting edge presentations here are showing testing that's going to go beyond that clinical so that we can really say, we got it. We think you now are free from Lyme disease. Come back if your symptoms come back in the next 2 years, but we think you are. So I'm very encouraged about that. There are, I'm an integrative physician and I've used integrative techniques forever. I still view this as a smart group of bugs, stealth pathogens. That used to be my favorite lecture for ILADS. And a stealth pathogen can sneak around your immune system, and mine can say, I'm a good guy, leave me alone, I'm good for you, and go everywhere. And we're kind of on to them now. And we're beginning to be able to catch that. I'm also encouraged, as I said, I work making CMEs, that we're beginning to get to the emergency room docs. We're beginning to get to the pediatricians and the family practitioners like myself, who are going to be the first person to see that person who comes in with a summer flu, or in California, an anytime flu, unfortunately. But we'll be able to start saying, maybe Lyme should be in the differential. Maybe I should think about this, right? And I'm very encouraged by that. I have much more ability to treat for shorter periods of time with antibiotic. I have more ability to understand how to save the biome so we don't do the harm but get the bug. And the government, thanks to people like Bonnie Crater, right, and the Center for Tick Action, really is beginning to acknowledge that we have an epidemic here, and they're putting a little bit of money that way so that we have centers for excellence, thanks to Cohen Foundation, and so
I'm hopeful again, and maybe I will be wrong in being hopeful, but I'm hopeful that the influence that RFK has on the current administration will bring us more focus on chronic diseases and hopefully on Lyme disease in particular. I am praying for that.
Yeah, I'm with you there. I think that emphasis may happen.
Dr. Green, it was really a pleasure to meet you.
And the
Thank
same.
you.
Thank you for
thanks for
doing
all the work
your
that
work.
you're doing, and thank you for doing everything you've done for ILADS and all the other great things that you're doing.
All right.
Really wonderful to have met you.